I want to introduce just a couple key folks from just CoLab today that are going to be playing a few roles. Anna Duncan is a program operations specialist at CoLab. She's going to be monitoring the chat. So if you have any kind of questions with your sound or video or anything, well, hopefully you'll still have your chat. You can put your question there, and then she'll be helping out with that, as well as questions that come up like during the presentation. We're going to be collecting those, and then we'll have some time for Q&A and discussion throughout and at the end. And Joanne Gonzalez is a program assistant at CoLab. She's going to be sort of walking us through some real life kind of polling activities throughout the presentation, and really grateful for her help. I also want to recognize that we have Dana Perlman here today on the meeting. Dana is a facilitator who's done a lot of systems design work just nationally with a lot of different organizations. She's going to be supporting some of the design activities and the facilitation of co-design with our team. As that team is growing, we're really glad that she's here today. So, and we agreed that I would walk through this presentation, but just want to note that this is certainly a collaborative affair. We've got great partners here already. So, just going to advance my slides if I can. But that was the welcome and introductions that we already did. So what we're hoping to do today is provide folks with sort of the broad goals of this project, where it came from, what it aims to do, and some of the values that are already going to ground the approach. Talk a little bit about the strategies that we'll use to walk through the different needs of the project in relation to information gathering and integration, and then actually developing out strategies. And we particularly would love folks on the call today to weigh in on ideas that they have for us about how to make this project as transparent as possible, so that even if people, time only allows you to play maybe a sort of a jumping in, peeking into this project kind of role versus something more formal like an advisory position. We want to structure sort of communications and information and opportunities for involvement to be as inclusive as possible. So we're going to be asking some questions about what you think would help us to do that in whatever role you might envision having in this project. And then we'll follow up with some kind of summative questions, next steps, get your thoughts about kind of your overall impression and concerns or sort of exciting kind of reactions that you had. We saved an hour and a half. We'll see how long we need to go, and we totally understand if folks kind of need to pop in or out, and we're just glad you're here for however much time you can give this. All right, so a little bit on the project context and background. So this project emerged initially from a series of meetings that CoLab facilitated with a multi-sector group of funders and policymakers from across the state. And our goal with that series of meetings was to identify an area of high priority in Washington State children's mental health that wasn't already sort of really being robustly taken forward and had already had a lot of attention. And what came out from that process was this desire to really look at how to support the cultural responsivity and evidence-informed approach of our public mental health system for kids and their families, while also expanding the lived experience workforce and thinking about how to bring sort of another workforce into the system that could provide direct therapeutic support so that we can better address the scope of need in our state. And so we worked with a number of partners and advisors. We ended up showing this and getting feedback from 10 different public behavioral health agencies, mental health agencies, as well as some other key core partners who are really focused on mental health equity, cultural responsivity, and kind of solidified these broad goals into 3 more specific project aims. So as I mentioned, one is really to support the expansion of the workforce, with, I think, our particular niche on this project being a focus on the clinical training and support for that workforce. A number of folks on this call, know that this is not the only project that would be looking at this. And there's a lot of really exciting efforts to look at, just the career workforce pathways into the workforce. I think what this project can do is really try to clarify the specific kind of clinical skills and supports needed, particularly to work around children's mental health. The second is to develop a training strategy to increase the cultural responsivity of the licensed workforce in Washington State while retaining a focus on those evidence-informed components. So as many of you might know, the approach that our lab takes towards evidence-based practice is really to think about those practices as components that need to be applied in a client-centered way. And we think that that's really amenable to culturally responsive practice, but we want to learn a lot about how those components could be used and when they may not be culturally responsive. And so as you'll see, we're trying to be very intentional about including diverse perspectives in this project so that we don't inadvertently miss something really important about how to be as culturally responsive as we can in our state. And at the third level, we know that it's one thing to develop kind of a clinical curricula or training, and it's another to really support an organization around implementation and to align the values of an organization to support the other 2 aims. So we've been working for a while with partners at the University of California, San Diego, of which I think we've got at least one person on this call there, from there, maybe a few. I can't see all the participants right now. And there's been a lot of support, a lot of research and a lot of development in that group already around how to provide kind of the support to organizational leaders, clinical directors and managers to support their team to deliver high quality care. So we'll be pulling from their expertise as well, knowing that all of our clinical experts and subject matter experts on this project are going to be ultimately working kind of at the direction of a co-design team that is made up of folks with lived experience of our public mental health system, as well as service provision and other advocacy roles. So as you can tell from kind of some of the language I've been using already, our approach to this project really reflects the conversations that we had with partners in its early formation as it was coming together. And what we heard from our partners is that it's going to be extremely important in sort of addressing something like cultural responsivity and the lived experience workforce, that we are being very accountable to the voice of lived experience and the needs and how to best serve the population in our state, and as well as creating a lot of transparency. As I mentioned earlier on, we're very eager to do that. So we would like to have a lot of voices and a lot of brains and a lot of hearts providing ideas and feedback and critiques of this process so that we can try to get it as right as possible. So this seemed, because these were the values that emerged in the formative stages, it seemed really appropriate to use an approach that our lab has used in other contexts that we refer to as co-design. Co-design is something now that is becoming increasingly known and popular. It's really becoming part of our zeitgeist, which is very exciting. CoLab's been using co-design approaches informally, since forever, but more formally using the term and trying to really delineate the the specific components of that over about the past 3 years, and have worked in kind of formal context to sort of understand it better and test it and try it out with a lot of partners around the state and in some other states as well. So right now we have support. This is being funded through a proviso from the legislature. The team has support for planning for 1 year. So part of the goal of the project is to develop something concrete enough to go back for additional legislative support, but also to look at other partners who get excited about this and want to be a part of supporting it to move it forward to implementation. So I'm going to just say a few things about co-design in the way that we think about it here at CoLab, because as I mentioned, it's a term that's being used, and I wouldn't say a lot of different ways, but certainly and maybe in slightly different ways. And the field doesn't have, there's a lot of different fields that actually claim the term. So this isn't an attempt to say like what it really is, but this is the way that we define it. And in our approach to co-design is really focused on using these methods for systems or policy solutions. And that's important because some elements of co-design are really about developing maybe a set of recommendations or a product, and that's perfectly appropriate and good use of the term. But because we think of it at a system or policy level, it means that we pull in sort of kind of diverse interdisciplinary lenses when we're thinking about how kind of what we need to have in place to do a good job. And as you can see from the slide here, there are kind of 3 kind of areas of thought that are informing our approach. And I'll just say a few words about each one of them. So co-production really comes out of a public policy or public administration literature, and it refers to the role that citizens play to directly design and directly deliver services that are sort of the role of the government. And this was a term that gained a lot of popularity in like the late 60s and 70s, and kind of went away a little bit and has really come back as an area of a significant focus and interest in how you make government more permeable and to citizens, and have citizens more actively involved in its operations. So when we think about co-production in terms of co-design, practically, what that means is that we're eager to have as much ownership as possible, sort of at the decision-making level, from folks who are directly impacted by the outcomes of these goals that I articulated. And it also means that we're going to be engaging in a couple sort of communications campaigns where we're eager to get as broad of reach as possible across Washington state, so that we can take feedback from folks who are consumers or citizens in the state to bring that back into the co-design process and help that shape the solutions that are generated. And participatory design is an area that really has grown out more from technology design. It's sort of it's kind of allied with but different from user design. So participatory design is centered in this idea of creativity as a way to absorb knowledge, but then be creative in developing various prototypes. So it's really about sort of knowledge management, with the participatory part really reflecting the same values as co-production, where we want the folks who are most impacted by the outcomes of this creative process or design to again be in as much full ownership as possible in determining what it will actually look like, because that ownership process is what really generates the best ideas, because people can really sort of feel personally invested in making it right, and we want to create the conditions for that kind of creative freedom. and safety. So as I'm gonna talk a little more specifically about design process, just to sort of make that a little more concrete with how we might use this here in this project. And then the last area, kind of broadly put under social innovation. And that's just the idea that there's a lot of eagerness for more creativity in how we approach social programs and sort of solving these social kind of science questions. And so there's various sort of schools of thought within this, but you see this happening in health services, innovation and research, and just broadly folks trying to think about different ways to kind of approach these broad important issues. So as I mentioned, so this is something that applies particularly to the design process. So the double diamond is a pretty widely known design model, and it was influenced by work done by Bella Banathy, with the idea being that to identify the best solutions to a problem, you first want to get clear about what sort of the issue or the problem is. And one way to think about it is we want to fall in love with the problem rather than the solution at the beginning of this process, and really approach these questions with a lot of curiosity and an eagerness to learn. So the first phases of co-design can sometimes feel a little ambiguous because they're heavily about learning and about exploration. But once there's sort of a broad amount of information that has been gathered, and the co-design team will work to synthesize that to sort of land on, okay, what is the broad goal that we have here for our future system? What is sort of the direction we want to go? And then once that's more clear, sort of the diamond opens up again, and we're looking at lots of different ways through prototyping that we could actually approach that problem. And then through, again, a series of iterations and discussion and sharing that out with broader partners, we sort of land on the solution that seems the most inclusive and will be most effective in sort of approaching that problem. And that's where you then have the end product. Practically, in terms of our project, I'm going to talk about how that'll proceed in phases. But first, just want to reinforce again sort of the program structure. So we're thinking about this broadly as a community coalition. And the community coalition has two groups that the team will sort of bring together in gatherings, with a third, kind of a third partnered group are folks that will engage more as informants through our communications campaigns. But of the folks that the project will bring together in gatherings, we're recruiting for the core design team and a broader advisory team. And the reason for doing this is that if we can represent these diverse perspectives and area of expertise at the advisory level and at the co-design team level, we feel like we accomplish two sort of goals here. One is to elicit kind of the diverse perspectives and needs of these different groups to help us with sort of that ideal of getting a lot of different ideas about what the problem even is, so that we have that full range of information before we start landing on a solution. So at the end of the day, we're hoping that the materials and the approach designed out will be really well suited and well fitting to the needs of folks using the public mental health system in Washington State, the broader population, as well as the service delivery systems. And then the other goal is that we're intending to engage broad ownership and buy-in and partnership on this, so that it's not just a good idea that's developed in this project, but that the perspectives and input from individuals all across the state have been incorporated in this so that folks are interested and eager to apply those ideas and those materials that come out of this process. This is another way to represent that at the 3 levels. And in this figure, you can see we also are eager to elicit public and community input. All right, so think of this as like overlaid on top of the double diamond. The way that we intend to work through this process is to start with values mapping. And it's really important to do values mapping because if the co-design team is sort of coming at this with different values and priorities, it's going to be really difficult to move towards identifying shared solutions. So we start with values mapping, which is also a shared learning process around the different perspectives that people have about this system and about mental health. So the co-design team can come to some shared vision before moving into information gathering and integration. Information gathering right now, and this could shift depending on sort of the guidance of the co-design team, but typically it's sort of pulling from 3 broad areas of information. So the first is the folks who are experiencing these systems. So we'll have mechanisms to go out and get information about how our public mental health system feels for folks, going through it. We might, if time permitting, and we have a year, but time permitting, we'd really like to think about creative ways to elicit this, either through maybe short videos or kind of audios or some kind of information gathering that helps that really come alive. So our co-design team can kind of join with that in a creative and empathetic way. The second general area of information gathering is going to be from our service delivery system. So what do they see that's already working well? What constraints do they have? What are their hopes and what are their concerns? And the third broad area of information gathering is the scholarly literature. And for this project, we see at least 2 buckets. The one is going to be around cultural responsivity broadly in terms of models and frameworks and how folks are conceptualizing this practically. And the other, of course, is going to be sort of the evidence-informed kind of components of treatment. And we're really going to have to line those up and think about where do they work together and where maybe they don't work together. And the co-design team is going to be sort of kind of tasked with reconciling those and figuring out how to move forward. Once the problem has been clarified and there's some kind of clear idea of where we want to head, then we'll go to prototyping and thinking about just practically, what does this look like in terms of what should be in a training, what needs to be sort of support for training, what are the kind of right size elements for a lived experience workforce, what are the supportive policies that might need to be in place, as well as how could agencies be best supported to carry these visions out. We'll land on sort of the specifics for that process. And then the beta testing is really sending those ideas back out into the broad community, including our payers, our ECHs, our service delivery systems, and consumers and citizens, and getting ideas about, does this feel like this is the right way to move forward? Or could you envision things that would make this more likely, more feasible, more acceptable? And bringing that into refined design before we work towards final development. So I talked a little bit already about these, might just reiterate a few different things with the goals for these different processes. As I mentioned, values mapping is really to be clear about what values people are coming in with and what they might like everybody else on the co-design team to know about what they think is extremely important, right, in children's mental health, cultural responsivity, or health equity. So everybody can be learning from each other before they sort of work together as co-designers. As I mentioned with information gathering, we're very eager to create kind of information gathering methods that help our co-design team and our kind of broader advisory committee and broader community informing this so that we can have a shared sense of what it really feels like to walk through our public mental health system, and where there could be improvements in ensuring that feels culturally resonant. And again, with prototyping, I think I already probably covered like what this needs to look like, but it's really about getting creative again with all the different ways that we could approach this once the problem becomes more clear. And then sending it back out to the broader community. As I mentioned, the hope here is to not just create something that, our team can feel really proud of and like it looks great and yay, we did that. But it's really to think about building a process where, the whole community in Washington State who is involved in our public mental health care system and maybe broader mental health care system can see themselves, right, and see their hopes and see their input in this development process, so that we can have those partnerships built for implementation. We have about 100 community mental behavioral health specialty mental health centers in Washington State that serve children and youth. That's sort of the initial focus of this for partnership and implementation, but we think that some of the learnings and innovations that come out of this process could be very well aligned with other efforts, folks looking at increasing the lived experience or community health worker workforce in primary care settings to support integration. Materials or ideas that come out of this process could be very well aligned with that, and those materials could be kind of ready to go to support that effort as well. So if there is opportunity to align with these different initiatives and great groups all over the state that are tackling this from so many different angles, we want to position it so that people can borrow and steal from this as much as possible, so that we can all be working together around the quality of our mental health care system. So I've been talking for a long time, and so I think we wanted to start, with a few questions about transparency. But why don't we just take a pause, since there are maybe a couple questions coming in, do a little bit of Q&A right now, and then move towards some kind of more group discussion about some of our project values here. So Anna, I might rely on you if you can just read out any questions that have come up in chat, and then if anybody's has some questions right now, go ahead and throw them in chat, and we'll spend maybe about 10 minutes right now doing that.
Yeah, so we can start with a question from Libby Hine, who said, could this be expanded to BA level providers along with peers?
Fantastic question. So to that, I would say that's absolutely likely to be a question that's going to be integrated into the design process. And I would, in terms of just conversations that our team has had now, we're definitely connecting with the folks who are doing the BA certification for mental health. There's interest, they don't have sort of curricula developed out already for children's mental health. They might launch into that. So if we can align around that, I think it would be really great. We're definitely in a lot of conversations with them. So it was BA, and what was the other level?
Oh, just whether or not it could be expanded alongside the peer model.
Right, exactly. So just maybe a couple things about peers that I think will be really interesting to dig into in this. I think that a question that the co-design group will need to kind of tackle is the goals for maybe direct therapeutic support with an expanded lived experience or kind of community health workforce that can do direct sort of basically light touch or coached therapy with self-guided tools, there'll be sort of a whole exploration of models for that pre-licensure. And then there's sort of the peer role, which is, there's philosophical views around the peer role really should not be right? Around like providing direct treatment. But then there's other models where peers preserve their peer role, but there is some integration of kind of light coaching of skills that could be aligning with what's happening in therapy. So I think that one of the goals of expansion of the workforce would be to expand the ability of expand our capacity to deliver direct therapeutic support. And the question about how that aligns with a kind of a pure peer role versus a peer role that maybe also has some coaching would just be something that the co-design team would need to grapple with. But I think just even clarifying those different philosophies will be a valuable part of the process. Great questions. Are there any other questions at this point or hopes? And there'll be some time at the end for that as well. All right. Well, then we're going to ask folks to give us a little feedback right now. And Anna, oh, is there a question that came in? Okay, Anna has just pasted this poll into chat. And what we would love for people to do is just spend a minute and answer these questions in Mentimeter. So the first one is ideas that you have about the kinds of practices that this project could put in place to ensure transparency with the public. And then what kinds of questions might we want to ask the broader community to inform this project? I'm going to stop sharing and Joanne is going to share her screen so that as those responses are coming in, which won't be tied to your name, so feel free to be as honest as possible. We'll just watch as those come in and do a little bit of reflection. So the first one again is what kinds of practices do we need to put in place to ensure transparency? And if you don't know, maybe anything that occurs to you about transparency or your hopes for transparency, even if you don't know exactly what kind of practice that might be. Well, these are already really good ideas. Excellent. Oh, you know what, Anna, I wonder if comments that might be coming in chat, if we want to get those into Mentimeter just so they're all saved in one place, or we'll just save them separately. We'll integrate them after.
Yeah, and on that note, feel free if you're having any troubles with Mentimeter to just pop it in the chat as well. We'll be saving both.
It's wonderful. Well, these are fantastic. Please just continue to enter thoughts as you have them about this. I know we've got, okay, excellent. And some are coming in on chat. So I'm going to spend just a minute because I don't think it'll take too long. Oh, we've still got some in. Okay, good. We will give like maybe 30 more seconds for stuff to come in, and then I'd actually love to read some of these out. And then after I'm I'm done reading them out. If folks have thoughts about common themes that are emerging, we're going to ask for kind of collective thinking about what we can take away. Our team will also be looking at these and doing a more formal synthesis. But would love to get folks sort of real-time synthesis of some of these themes as well. Okay. So let's see, Joanne, if you could scroll back to the top, just for clarity, and in case some folks aren't looking at the screen right now, I'll just sort of summarize some of these. So the comments reflect public forums to share back with our communities of interest. Having a routine process, so a strategy for timing, the platform, and the communication style. Having meetings that are completely open to all who want to attend. Roundtable meetings. Making room for dissent or contradictory views in a mutually respectful manner. Doing our best to be honest with the community and bringing the community to help discuss issues within the community. Another similar focused one, community orgs and representatives should have a strong influence in design process and strategy. So limiting red tape about what can be discussed, having honest and accountable answers to people's questions. Thanks, Joanne. Having a variety of methods and venues to solicit feedback. So thinking about social media, formal releases, forums, listening sessions, videos, etc. Having community involvement throughout the process so they stay informed at all stages and can shape decision-making. Community forums being honest and transparent with everyone and being open to all community members, and involving media at all levels, inviting in reporters, getting articles online, print broadcasts, op-eds, invite comments. And then just looking at the chat, getting engagement virtually and in person, and focusing on building off of strengths, as well as asking community what is working well. And I think there might be an upvote for that comment as well in the chat. So would love folks' thoughts about common themes that sort of struck you. If you want to put those in chat, or also just feel free to kind of raise your hand and we can also just have a verbal kind of discussion. Few things occur to me here clearly about having events and meetings open to all. Really thinking about community representation. Having a good plan for communications where we're thinking about multiple venues, both for discussion as well as information. And I'm feeling they're seeing some themes around the room for dissent, the room for debate. I see that in the op-eds and the comments, and I think about ways that we actually invite maybe contradictory views and try to elicit some of the important tensions in this work by specifically asking for it to get surfaced. And I see a comment here in chat about extra care and transparency for lived experts involved in the process. Thank you, Lily. So particularly focusing on what lived experts want to see. And I think that also relates to some of the themes about really relying on our community orgs and representatives to be sure that the strategies that get set up here are really reflective of those voices in particular. Well, anything else folks sort of see or want to share? These are really fabulous ideas. I want to share, I'm completely thrilled. We actually have our first formal communications manager on board at CoLab, and we're really learning a lot from her, from Rachel. And that'll help us try to actually enact a lot of these. Financial transparency from Taquisha, that's excellent. Excellent suggestion. All right. Well, why don't we move to our next question? If you might have, some people may have already answered it. So our next question was around the kinds of questions we want to ask community to inform this project. And I will kind of note we're interested in this broadly, and we're specifically interested in it as shaping the first communications campaign of this project. We are hoping to field at least 2 really broad campaigns during the next year. One here towards the beginning, so that the views of community are shaping design from the earliest stages. And then another towards the end as prototypes are emerging and options are emerging to get feedback on how well those fit and or what else people would like to see. So in terms of the kinds of questions we want to be asking people. Thank you, Diana. Thanks for being here. All right, so I'm just going to again sort of read some of these out. Some of the themes repeating the really important critical processes for advertising the meetings and opportunities to participate in really diverse array of forums. Asking the community on how they want to get info, whether they prefer videos or newsletters or going to a meeting. In terms of a specific question around the mental health system, what can we do for you? What do you want to see change or happen? Is this project something you care about? That's a great one. And then structured evaluation and feedback opportunities, and be open to change process, which I really appreciate. That is one of the goals of design, right? Is like we may realize halfway through that there's just something else that's sort of another focus for the project that would be more impactful. What are the ways the community has already been supporting themselves? What barriers have they seen in the past? What hesitations do they have about this project? That's a great one. Again, be intentional about diverse perspectives. Engaging a few high schools classes which we could present and invite student essays or something similar. I love that. It's a really creative suggestion. Again, asking how community wants to be involved in being sure that we're inclusive with interpreters, trying to find ways to reach people from all backgrounds, and then specifically asking the cultural barriers to care, what needs to change, what's going well, what do people like, what do they want to keep going, what do they want to elevate or expand, what are the characteristics of helpful service, what has or not been helpful, and multi-generational perspectives. Fantastic. Let's see if any have gone to chat. I'm seeing a few more themes too around really trying to elicit what's going well. We know we have talented and committed folks in our public mental health field, and if we can lift up the things that people are already doing that are creative and folks are experiencing and really enjoying, I think that this is an opportunity to do that. How will we know if we've met our goals? What will it look like? What will be different? What will they be experiencing that's different? Thank you so much. These are fantastic. So as I mentioned, our team is going to take these and synthesize them. And right now with this, we are very accountable to you in this group. So we will be sending back to you sort of some specific ideas for how we interpreted this and how that'll inform a communications campaign, platforms, questions, opportunities for diverse feedback. And then to the degree that this group is interested in responding to that, let us know if that's matching what the themes are that you're seeing here and what your own hopes are. So thank you. So I think we can go back to me, my slides. Give me a sec. So a couple more thoughts about involvement. Again, along the lines of being as inclusive as possible, we're already kind of brainstorming ways that we can engage a broader community of co-learners and folks who have expertise around their own lived experience or their expertise around some of the kind of the problems and solutions that the co-design team will be grappling with. There's essentially 3 levels. The co-design team will be meeting every other week for 6 months, so that's a pretty intensive commitment. And the role there really is going to be the actual designing of the strategies. We will have folks who will actually write up products, but the co-design team will be directing sort of our product developers, right, on what those need to look like based on the values and the opportunities for change that would be identified through the process. And kind of going back to that model of representation, we're eager to have diverse representation on this co-design team from folks who are experts in lived experience, as well as the service environment, treatment for children and youth mental health, and health equity and culturally responsive practice at a minimum. And then we'll have the advisory group, which we also want representative of kind of all those different areas of expertise. The advisory group will meet about every other month and will be the group that is sort of accessible to the co-design team as maybe tensions emerge, not relational tensions, we hope, but just tensions and kind of concepts or models. And this will be the team that supports and helps sort of direct the co-design team around maybe the directions in which to resolve some of those tensions and kind of be there to provide that immediate kind of sensing. And then that broader community group will be eliciting, we'd like to elicit feedback from probably in an invited, almost membership way. So we would like to engage a group of folks broadly from the community who will get probably very frequent communications about this project, and then lots of opportunities to weigh in. One of the kind of mechanisms for this that we're exploring is actually creating sort of an environment where folks can give feedback on different elements of the program and actually be compensated to do that, and finding some way to track level of involvement so that we can apply compensation back to the labor that they spend sort of weighing in on some of these things that don't require them to come to like a formal advisory meeting, or it can be kind of at their discretion on how to participate. All forms of participation are compensated to the kind of the need of the individual, whether there's a need to compensate at a system level. Certainly anybody with lived experience expertise or an advocacy, we would compensate for their time. I was just told that my Zoom is echoing and I really apologize. It's just been doing that. So I think it's probably best for me to just forge ahead. So I would like to note, like at this stage, all of these ideas, right, we're just like trying to take in ways to just sort of create structure and process that is responsive to this desire to have broad community input, as well as sort of a group of folks that are going to like move it forward and make decisions. And so if you have other ideas just around levels of involvement that you think could be more helpful, or you could see something like getting missed with these models, we would really love to hear from you. All right, so we're kind of moving towards, some of just kind of our wrap up at this stage for, I don't know, what you're seeing, what you think is good, what are you curious about, what, and then specifically how you might like to get updates about this project. So we're going to ask you to go back to Mentimeter, and then would love to have kind of a Q&A, whether that's in chat or you want to just raise your hand and we'll talk. I'm going to go back to stop having Joanne share her screen. And we'll just start with like, what are you most curious about? This is really intended to be very open-ended and broad, so we can just sort of gather how this is hitting you. And do some sensing on our side about anything that's seeming good or that we might need to change or that we should be answering as part of this process. Thank you, Erica. Glad you could join. Erica's one of our partners from UCSD. Great, we got one response. Keep them coming. We're really eager for folks' thoughts here. And they're not tied to your name, so you could just ask us anything. Excellent. Great. We know some folks are probably needing to drop off at the 11 o'clock hour, so we will happy to send these Mentimeters out as well if you don't get a chance to respond to them. Oh, it's great to see these responses come in. These are wonderful wonderings. So helpful. I really appreciate the wonderings about the end product because I'm very curious about that myself. And as with like the Double D design, right? We're going to try to fall in love with the question first before we start thinking about what products are going to be enacted from that. But I think we can think about the definition of sort of the problem statement or the need statement as our first product, and keeping kind of community involved in that process as a learning process. Right. These are wonderful wonderings. I think we'll go ahead and I'm seeing, again, curiosity about the end product. We are too. Thanks, Larry. And some questions just about structure and really important questions about accountability and not making this something that looks good, but actually doesn't really serve community members or shift power. I really appreciate the challenge and the kind of ask and the call to make that really clear in a way that feels transparent and can be critiqued. So thank you for that. Let's go to the next question. love folks to just think a little bit about barriers. Of course, it's kind of hard to know exactly without without a prototype, right, to put in front of you. This will be a question we'll be coming back to a lot as things evolve. But if anybody has anything right away that they feel like you might want to be thinking ahead to address, this is the time. Yep. Thank you, Cindy. Thank you so much for being here. And I owe you an email. I'll be following up soon. I really appreciate the question about representation. And there's also a note in chat about there are just system barriers. So we'll have to be thinking about enacting sort of a vision for kind of what this could look like within constraints of our system, but also thinking about ways where this effort or this kind of gathered coalition of partners could be helpful in some of the system questions that are being asked at a broader level. So there could be opportunities as this emerges to partner with that. Funding, yeah. So again, financial transparency, we have a year for planning. We'll have to find money for implementation. Yeah. Appreciate calling out sort of some of the urgency in white supremacy culture, how we share information, how we engage, needing to move forward, show effectiveness, and how that might conflict with some of the relational process needed as part of the project. Thank you for that. All right, let's go to the third, I think our final question. Oh, thank you. There's a barrier around just burnout, trust of the process. I do appreciate that. We're actually, I'll just, again, to be very transparent, I know this is kind of COLA presenting out on this project. Our goal is actually to develop a strong working partnership with other organizations. And we're kind of exploring those right now so that we can engender that trust through true accountability, through true partnership, financial and in ownership. One thing that I probably should have said earlier, now that some folks have dropped off that are in other documents and we've said before, one of the ways that we thought we could help move this project out from other efforts to develop out like clinical materials or whatever is that the intellectual property of anything developed out of this process would actually be held, sort of be at the discretion of the community coalition in terms of where to hold that. So this would not land at the University of Washington, for example, in terms of intellectual property and ownership. So that's one way that we are trying to set up those agreements right in the beginning. And again, everyone's overwhelmed, and particularly the behavioral health provider community right now. Okay, let's go to our last question. So we would just like to know from you all from this, if you envision yourself wanting or being interested in one of the specific roles that we mentioned, we definitely want you to get a hold of us. If the advisory, as some of you have already agreed to that, thank you, advisory, or even a co-design role seems attractive to you. The next slides that we're going to show has our contact info. We have sort of a emerging campaign around communication. So this is really, we're very eager to hear from folks who aren't sure if they would play an advisory or co-design role, but want to stay connected to this or have the opportunity to kind of, peek in and see what's going on, or So if you could add here what feels like the right frequency, like some of the stuff we're sort of wondering about is like, you know, if we just send stuff out through our typical listserv, people could be getting emails about this very frequently. Is that what people want? Do they want to opt into that? We just love to know kind of how people are feeling about the degree to which they want to hear about just like every step of the way, kind of at major points. Love the specificity of the first suggestion. That's really helpful and great. Other thoughts just about frequency, or maybe maybe you're not so sure about frequency, but you want to know particularly when something happens. Weekly, thank you. Any other thoughts? Be so helpful to us as we've all got you here somewhat. I think we might need to repaste the link to Mentimeter, Anna. And also the question on Mentimeter is just how often do you want to get updates about this project, which you can also just put in chat. Similar formatting, so people can kind of quickly find what they need. So I'm thinking that, Steve, what that says to me is like just sort of a structure, kind of maybe like headlines for buckets of information, with the information potentially changing, but the structure staying the same, maybe. That's not right, just chatter. Updates on a website. Awesome. Okay, we'll take it. Thank you so much. And we're following up with a lot of you anyway about rules. So I'm going to go back to sharing my screen just so folks who want it have our contact information. And we also just want to make sure we're providing some time right now for anybody who does want to stay to do some Q&A. Oh,